Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Differentiating the tuberculoid leprosy versus the lepromatous leprosy. So first, let's understand the tuberculoid leprosy. The tuberculoid leprosy, it is the number of lesions is 1 to 10, and the distribution, it is asymmetric, and it can be present anywhere. So how is this definition? So definition wise, it is there is a defined edge. So there will be a defined edge, and it is markedly, it is hypopigmented. Next, let's talk about the anesthesia. In terms of anesthesia, it is early marked defined localized skin lesions. It is a defined localized skin lesions, and the major peripheral nerve involves a major peripheral nerve. Next, what about the autonomic loss? It is early in skin. Autonomic loss is that it is early in skin and the nerve lesions. Next, talking about the nerve involvement or the nerve enlargement. The nerve enlargement, it is marked and in few nerves. Then talking about the mucosal systemic, the mucosal and the systemic, this is absent. And the number of Mycobacterium leprae, it is not detectable. Now let's move on to the lepromatous. So talking about the lepromatous spectrum, there are the lesions will be 100. So there are 100 of lesions and they are confluent. So what about the distribution? Distribution wise, it is going to be symmetrical, and it is avoiding the sore areas. Next, talking about the definition and clarity, it will be vague edge, whereas in tuberculoid it was clearly defined edge. Here it is vague edge, and tuberculoid had completely hypopigmented. Here it is slight hypopigmentation. Slight hypopigmentation. So talking about anesthesia. Anesthesia, there is a late, initially slight. It is late and initially slight, and it is ill-defined. It is ill-defined but extensive over the cool areas of the body. Next, talking about the autonomic loss. So what happens to the autonomic loss? The autonomic loss, there is a large extensive as for the anesthesia. It is late and it is extensive for anesthesia. Then talking about the nerve enlargement. The nerve enlargement is that it is slight but it is widespread. What about the mucosal and the systemic? The mucosal and the systemic, it is common and severe during the type 2 reactions. It is common and it is very severe during the type 2 reactions. The number of Mycobacterium leprae, this is going to be numerous in all affected tissues. It is numerous. in all affected tissues. Channel.